but I've forgotten it.
Joni Comstock.
Joni Comstock. Okay, let her rip.
In preparing for today's presentation, I really struggled with how to best convey this highly important Lyme disease information to you. On the one hand, Lyme disease is just a disease like any other disease, so presenting the basics on Lyme should not be that tough, right? A quick check of WebMD and you've got all the facts that you need, right? Well, not quite. On the other hand, maybe some of you are already well aware of the fact that Lyme disease is the fastest growing infectious disease in the US, far surpassing AIDS, swine flu, and the West Nile combined. It is also hands down the most controversial disease on the face of our planet right now. Can you imagine that? How can this be? You may be thinking. How can it that this seldom talked about until relatively recently disease discovered in the 1970s in Old Lyme, Connecticut, hence its name, is so highly controversial? We are told it's rare, it's only caused by a bite of a specific type of tick, and that it's supposedly very hard to catch and very easy to cure. The reasons for this are so complex that there is no way I can get all the information across to you today. But just know that this is one highly controversial disease, from its name to if it's just one bacterium causing it, to how you acquire it, how you diagnose it, to how you treat it, and even if you can really cure it. There is even mounting evidence that what is called Lyme disease may be at the root of some of the most common and debilitating diseases of our time. And sadly, it's affected all of our lives in one way or another. From Alzheimer's, multiple sclerosis, and Parkinson's disease to all autoimmune diseases and autism. Imagine what an incredible medical breakthrough this could be if only this were allowed to be further researched. A major consequence of decades-long controversy and debate is that Lyme patients continue to suffer significantly, oftentimes losing their careers, their spouses, custody of their kids, their homes, their relationships, quality of life, family, friends, their life savings, virtually everything. Here's an important statement by a renowned Lyme disease expert, Dr. Kenneth Ligner. In the fullness of time, the mainstream handling of chronic Lyme disease will be viewed as one of the most shameful episodes in the history of medicine, because elements of academic medicine, elements of government, and virtually the entire insurance industry have colluded to deny a disease. Please keep that in mind as we go through today's presentation. What is Lyme disease? Caused by the bacterium Borrelia burgdorferi, it's a type of spirochete, just like the kind that causes syphilis. Lyme disease is officially classified as a type of relapsing fever. Though known as the disease that causes a bullseye rash, EM rash, or target rash, few people infected exhibit this rash. Instead, the bacterium bores its way into the brain, the central nervous system, skeletal system, as well as every organ in the body. There are more than 100 strains of the bacterium that causes Lyme in the US and 300 strains worldwide, including mutant strains. The various types of bacteria that cause Lyme are in our blood banks across the US, and the CDC is aware of this, yet nothing is being done about it. Crazy, isn't it? Deaths occur as the result of Lyme being misdiagnosed as one of over 350 other conditions and is mistreated, undertreated, or simply not treated. In addition, suicides, sadly, are very much a reality of Lyme disease. Studies show that the quality of life of those suffering from chronic Lyme is worse than those who have suffered a recent heart attack or have type 2 diabetes, according to the NIH, the National Institutes of Health. It is estimated that Lyme disease costs at least $1 billion annually in the US, which leads us to this. What does Lyme disease feel like? Please close your eyes and try to remember how you felt on a day when you woke up with the worst flu of your lifetime. Now imagine that this flu never went away, and then you got a cold on top of it. Imagine the horrendous pain all over your body coupled with extreme fatigue. Now imagine not just the bodily pain, but also that your mind starts doing odd things and playing tricks on you. You feel more anxious and depressed than you ever thought imaginable. You may even start having panic attacks, crying spells, or rage. And add to this, imagine that you can no longer remember how to do simple things like how to spell or do easy math equations or how to find your way home from the mall. And these perplexing and highly troublesome symptoms wax and wane and change daily so that you never know what you're going to feel like from one day to the next or moment to moment. And this goes on and on and on. Unrelenting, day in and day out, with no relief in sight for months and even years, with doctor after doctor telling you that despite how you feel, there is really nothing wrong with you. And the doctors tell you that you're depressed, or that it's all in your head, or that you're a hypochondriac. How would you cope? What would you do? You can open your eyes now. Though it sounds like some dreamed up science fiction nightmare, that's a fairly typical scenario for many of the Lyme disease patients. And our government is doing nothing about this national health crisis. Can you believe this? The consequences of remaining undiagnosed and untreated. It takes most Lyme disease patients years to be diagnosed, and this wastes precious time because the window of opportunity for the hope of successful treatment starts closing with each day that you go untreated, from the moment that you are infected. By the time most Lyme disease patients are officially diagnosed, years have passed and countless amount of dollars have been spent, and they have seen dozens of physicians and have had multitudes of tests done that showed nothing, including Lyme tests, since all but a couple are highly unreliable. The majority have been misdiagnosed with various syndromes or labels such as chronic fatigue syndrome, fibromyalgia, panic attacks, and opportunistic infections such as chronic sinusitis, bronchitis, laryngitis, ear infections, shingles, ringworm, yeast infections, and E. coli, to name but a few. These have started to take over as the disease has left to fester untreated. It is a cold, hard fact that when a Lyme patient does not receive treatment until the very late stages of infection, they may endure permanent pain, arthritis, neurological damage, even after recovery via treatment with antibiotics. Yet our government and our medical community remain in denial of the scientific fact, avoiding the subject whenever possible. Which leads us to diagnosis and treatments. The Centers for Disease Control, the CDC, recommends using the diagnostic testing recommended by the Infectious Diseases Society of America, the IDSA, and remains seriously outdated and inaccurate, as do the treatments. This may be the most important message of my presentation. Do not rely on the standard two-tier testing that our government instructs all U.S. healthcare providers to use. Why? It misses up to 70% of the positive cases of Lyme disease. They only test for one strain of the bacterium. Later in this presentation, I'll give you the names of a couple of specific companies that offer the most reliable testing. I cannot tell you how many times I have been contacted by seriously ill patients who insist that they do not have Lyme because their doctors tested them and they were negative, only to find out that this two-tier testing was used. Once they were tested with better, more accurate tests, they turned out to be highly positive. As for treatments, oral antibiotics from various antibiotic classes are necessary, sometimes for months to years. In long-standing neurological cases, IV antibiotics are required, though fewer and fewer physicians are willing to go this route for fear of getting into trouble with their state's medical board. Remember, the earlier you diagnose and treat Lyme disease, and I mean within days to a couple of weeks of contracting it, the less likely you will require prolonged, intensive antibiotic treatments. Also, multitudes of alternative and complementary medicines are now routinely used, and there is an extensive list, from herbs such as cat's claw and teasel root to infrared saunas and Rife machines. They all have their place in the treatment of Lyme disease. And while prescription antibiotics may seem like an extreme, harsh treatment method, even most naturopaths agree that unfortunately Lyme disease, especially cases that have gone untreated, cannot be successfully treated with herbal remedies alone. And still, no cure is guaranteed due to the very nature of the disease and the ability of the spirochete to not only bore its way deep into places that most medications cannot reach, but to change forms hiding in the body and evading treatments. So in short, safe, effective, sure cure treatments for Lyme disease are sorely lacking and much more research is needed. More Lyme facts. According to the very latest findings announced just a couple months ago by the U.S. Center for Disease Control, the CDC, Lyme disease is now a tremendous public health problem, with 300,000 new cases being reported in the U.S. alone every year, which is 10 times higher than previously reported. And even that figure is most likely an underestimate. Despite what we are led to believe, Lyme disease is reported in every state in the U.S. and around the world. Ticks migrate on birds and other animals who don't observe borders. Lyme is everywhere and it's spreading like wildfire. May is Lyme Disease Awareness Month, during a time when ticks are most active. People are under the impression you cannot get Lyme disease in the winter because ticks have died off. Not true. It's been proven that ticks are living and thriving each and every month of the year. Please do not think that Lyme disease is only transmitted by a specific type of tick or just by ticks alone. Lyme disease is transmitted by all sorts of ticks as well as other biting vectors like spiders, fleas, biting flies, red ants, mosquitoes, mites, and lice. Tick babies, known as nymphs, are particularly troublesome since they are easily missed because they are about the size of a period at the end of a sentence. Since the ticks inject humans with an anesthetic, which when they are feeding on us, the bite is painless and many people do not realize they have been bitten. Lyme disease bacterium has the ability to enter the brain very rapidly after a tick bite. Contrary to what you may have heard, it takes much less than the commonly reported 48 hours for an attached tick to transmit Lyme disease to you. Ticks harbor many other diseases that can be transmitted to humans aside from Lyme disease, including other bacterial infections, viruses, and parasites. There are many diseases, some life-threatening, carried by ticks that can complicate diagnosis, treatment, and recovery, including but not limited to Babesia, tularemia, anaplasma, mycoplasma, Rocky Mountain spotted fever, and Bartonella, also known as cat scratch fever. All of these and more need to be looked into when Lyme disease is suspected. Lyme disease and co-infections are a lot more serious than you were led to believe because of the misinformation handed down by government, public health officials, and the media does not typically portray this disease as one that is as truly serious as it really is. Lyme is called the new great imitator. Syphilis was the first great imitator because it can mimic so many illnesses such as multiple sclerosis, fibromyalgia, lupus, chronic fatigue syndrome, Parkinson's, Alzheimer's, and even autism. as well as over 350 other diseases, conditions, syndromes, from panic attacks to heart attacks. In fact, it should probably be called the Great Initiator, since it is turning out to be a possible origin of so many of these conditions of unknown origin. This brings us to May 12th, International Awareness Day, which will be the 22nd anniversary and the entire month of May to promote and support global action to speak out, protest, and demand our voices be heard on the weekend of May 12th for all related complex immunological and neurological diseases, SIN for short, including Lyme disease, myalgic encephalomyelitis, and other labels and syndromes that I've named off. The controversy. There is tremendous divide when it comes to the appropriate standard of care for Lyme disease, much to the detriment of all Lyme patients. At the root of this controversy is the ongoing disagreement between the U.S. Centers for Disease Control, which takes its directives from the Infectious Diseases Society of America, IDSA, and the rest of us. Despite the mountains of patient evidence to the contrary, the CDC and IDSA continue to insist that Lyme disease is hard to catch and easy to cure with 30 days or less of antibiotics, even if the infection was left untreated and has become disseminated and/or there are co-infections. They believe that if you're still sick after a short course of antibiotics, then you have something else, typically an autoimmune disorder, for which they claim there are no known causes or any number of psychiatric conditions. On the other side, the suffering of patients, another professional organization known as the International Lyme and Associated Diseases Society, ILADS, believe that persistent symptoms after the initial treatment reflect ongoing infection. ILADS trains doctors to become Lyme literate medical doctors, or LLMDs, and these doctors use the best diagnostic tests available, coupled with clinical observation, and they gauge the duration of treatment by the patient's individual clinical response to antibiotics as well as additional therapies. And so this great Lyme debate continues, as it has for decades. And again, patients are continuing to experience tremendous suffering on every level imaginable because of it. And as long as this debate continues, patients are in a losing battle. What can you do? Educate yourself about the early and obvious warning signs of Lyme disease, most importantly, the invisible symptoms. Realize that if you or someone you know has been diagnosed with chronic fatigue syndrome, fibromyalgia, MS, ALS, Parkinson's, Alzheimer's, autism, or any other chronic syndrome for which there is no known cause or cure, that it would be prudent to be evaluated for Lyme disease. If you suspect that you or a loved one has Lyme disease, please take the time to track down an LLMD, or at the very least, a medical professional who is open to the existence of Lyme disease as a possibility. Typically, and this is so counterintuitive, this means to stay away from university teaching hospitals because they are most likely going to be following the dictates of the CDC and the IDSA, and you will end up not being diagnosed with Lyme disease. Please, please, please make sure that anyone needing testing for Lyme disease specifically request testing from IGeneX in California, which is www.igenix.com, or Advanced Laboratories, www.advanced-lab.com in Pennsylvania, not the CDC's two-tier test. Call your local hospitals and ask what diagnostic treatments and protocols are for early and chronic Lyme disease. Offer to send them or direct them to accurate educational materials or help them to plan an educational seminar. Call your local state, and national government officials and ask them to support legislation that will rescind IDSA guidelines and demand research be funded in the right direction so that progress can finally be made. Call your medical insurance agent and ask him or her what they know about Lyme, then spend some time encouraging them to include the care of chronic Lyme as a legitimate claim. Talk about Lyme with your friends and family. This disease is real and can be completely devastating, and the people that suffer from it must refuse to accept to remain silent, invisible, and disbelieved. Be sure to watch the award-winning documentary film Under Our Skin. You can find it right now for free on Hulu.com. Watch it with your family, friends, neighbors. It provides critical information on Lyme disease that can save lives. In closing, we cannot allow this debate to continue while an epidemic is being ignored. But reform, better testing, better treatments, physician education, justice, and a cure will not happen by itself. The future of this disease and ultimately the quality of our lives remain unwritten. Please get involved. We need your help to survive this mounting plague. The life you save may be a loved one's or your own. Thank you.
Tell us how you got involved in it, your story.
Well, I went misdiagnosed for 14 years. My first diagnosis, believe it or not, was postpartum. And the doctor kept telling me that, and I said, my baby is 4 years old now. There's my baby right there. I said, how long am I supposed to be postpartum? So then I got the diagnosis chronic myofascial pain. Then I received the diagnosis of fibromyalgia and a number of other diseases, and finally after more tests, which I took off the internet and took into the infectious disease doctor, and he diagnosed me with chronic fatigue syndrome. I talked about the two-tier testing. My ELISA test, which is the first line of the two-tier testing, came back positive, just barely, but it was positive. So they followed up with the Western blot test, and it came back negative. So I was told, oh no, you don't have the Lyme disease. But I had all these symptoms, and it pays to be your own best healthcare advocate and research, and don't follow everything that you're told by one doctor.
What were your symptoms?
All of those that were listed up there. I mean, I went through head pain, migraines, eye pain. Now I'm even sensitive to light and sounds and stimulation. The flu-like symptoms, getting all those infections, chronic infections that I had over and over kept reoccurring. In fact, I had the doctor test me. I'm like, do I have AIDS or HIV? I keep getting sick with all these infections. But this is non-HIV. This is like a non-HIV AIDS number 2. It's similar to that, and even if you Google that, that comes up. It's that serious. Being a spirochete, which is a cousin to syphilis, it's corkscrew shaped and it goes in the body. And so after I had those diagnoses, I also ended up with degenerative disc disease. So I have a metal plate and screws in my neck. I've had internal organs removed. I fought to hang on to my salon as long as I could. I had my own salon in the lower level of my home, and that's what I was doing. But I had to close that up December 2004. I was dizzy, I was sweating, you know, I just couldn't even stand. I was like leaning against the wall or trying to sit on the shampoo chair to finish rolling up. I would excuse myself from the salon. Well, if they were under the dryer, it was easy to do, and I'd say, I'll come back, you know, or if they're processing. But there was a few times I had to excuse myself and just go upstairs and lay down on my bed until, you know, it passed. And I kept trying to work my schedule around the clients, around when I was best, and rescheduling until I could no longer do that anymore.
Well, we thank you for your education.